part 2. We got cut off the first time. So we're going to be looking at the ears and palpating the ears for any tenderness, any lesions. And Zachary, you don't have any tenderness to your ears, correct?
Not to my knowledge.
Okay, perfect. And we're going to be feeling under the jaw for any lymph node enlargement, and I don't feel any of that. Okay, and then if you will, we'll be checking the thyroid, so if you will swallow. Okay, perfect, and that felt normal. So now we are going to look in the patient's ears. And we're going to be pulling up on the ear, taking a look. And we have a pearly gray looking eardrum here. And another pearly gray eardrum. Zachary has just been treated for bilateral ear infection, so Zachary, congratulations. The antibiotics worked.
They worked.
Okay, so we have checked cranial nerves 9 and 10 when we checked his soft palate a moment ago. And also would like to note Zachary has no tonsils, so we did not see those obviously. Now, Zachary, I'm going to ask you to shrug your shoulders. That's checking cranial nerve number 2.
I do it all the time.
All right, perfect. And your sternal notch, we'll feel it, and it is in midline. Now, if we were able to, we would place the patient at a 45-degree angle to check for jugular vein distension, and I do not see any. And we're going to check the carotid pulses.
Isn't that an artery?
One at a time. Yes, it is a carotid artery.
That's what I thought.
And that one feels good. Both of the carotids feel equal bilaterally. Now we're going to auscultate with the bell of our stethoscope for any bruise. And so Zachary, if you will breathe in and out.
Need I sit up straight for this?
You can. All right, take a deep breath in and blow out. Okay, and then I want you to just hold your breath for a second. Okay, let it out. Okay, hold your breath for a second. Perfect. Okay. Sounds normal. Okay, so a moment ago when we palpated your neck, you didn't feel any tenderness. No tenderness on your neck.
Nope.
Okay, and everything feels normal here. I don't feel any masses, so that looks good. Feels good. Okay. So next we're going to be looking at your chest and moving down that way. Okay?
No, boy.
So
I see the whole muscle share idea.
So you're going to just take a look at the patient's skin and look for any masses, anything that's not symmetrical. The hair distribution's normal. Also look at the back and a little bit of acne, but otherwise nothing abnormal on his back. It looks clear. Okay, now there's no barrel chest here, and then we'll also take a look at the rib cage, and it looks normal. Okay, now the chest expansion was good. No tactile fremitus. Okay, so next we're going to auscultate the patient's lungs. And we will start up top and we will be listening to the bronchial sounds. Then we'll move midway to the bronchial vesicular, and then in the bases we will be listening to the vesicular breath sounds. Okay, so Zachary, can you take some deep breaths for me? Perfect. Okay. Now, I'll go ahead and listen to your back. And we just have to be careful that we are listening not over the shoulder blades, not over the vertebra, but on both sides of the vertebral column.
Again.
Okay, next we will be listening to his heart, and we know that there are several different areas that we listen to, and on the right hand side at the second intercostal space is the aortic valve, and then the pulmonary, and then there's Erb's point, the tricuspid, and then the mitral valve. And this is where we will assess the apical pulse for 1 minute. And you can use the bell of your stethoscope to really listen for any murmurs. And I've heard the lub-dub, and so the heart rate is regular in rate and rhythm. Okay? All right. So, Zachary, you're sounding good so far.
Yeah.
All right, next we are going to look at the pulses, and the radial pulses are both normal. Okay, and then the brachial. They're both normal as well. Okay, now if we had an exam table, I would have my patient lie down to inspect the abdomen. Now, Zachary, this is something we have to ask our patients every day, when their bowels move last.
I think I pooped earlier today.
Okay, so today.
Yeah.
And have you had any trouble peeing or
No,
voiding?
not at all.
Okay, perfect. So what we're going to do is we're going to inspect the abdomen for any lesions. We're going to observe the color, and we're going to listen to bowel sounds in all 4 quadrants. And you can just breathe normally. Perfect. And if my patient was lying down, I would do some light palpation and the deeper palpation to feel for any masses or any kind of abnormality in the stomach, okay? All right, we are gonna assess your range of motion in your shoulders and your hands. And we'll start with your hands. Check cap refill, which is less than 2 to 3 seconds, so that's good. And can you move all your fingers for me? Perfect. And your wrist. Okay. And good. And then the same on this side. Can you move all your fingers? And your wrists. Okay, perfect. And go back and forth, up and down, and out. Okay.
Looks like I'm doing a weird cheerleading routine.
Perfect, perfect. Okay, so good job with that. Now, I want you to look well, we're gonna do the walking thing last. Next, I would look at the patient's feet and I would inspect between the toes. And Zachary, if you can take off your shoes real quick
Just think maybe 2 inches taller.
and your socks.
You about to get
Okay.
knocked out cold, but
And I would look at the legs for any temperature, or I would look at them for any swelling, any pain in the legs. I would feel both legs for temperature differences, and then I would also check cap refill in the toes, which it's less than 2 to 3 seconds. I would feel the dorsalis pedis pulse, and it's normal. And then the posterior tibialis,
didn't I break the tibial bone?
yes,
Yeah.
you did it one time.
Oh yeah, it was this one.
Okay, now, Zachary, if you will, just stand up. Now, if you could do a few shallow knee bends for me.
So, that
Yes,
kind of thing.
yes. Now, I want you to, I'm going to inspect your spine while you reach down and touch your toes.
Oh boy. It's a challenge right here.
And his spine feels in good alignment. I don't feel anything that would indicate
Scoliosis.
scoliosis, right. Okay, so I'm going to have you walk to Patty's desk and back, and I want you to do walk on your toes.
So,
All right, perfect. Now, I need you to walk on your heels. Okay?
okay.
All right, so let's see you walking on your heels.
Try not to march.
Perfect. Okay. All right. Now, Zachary, I need you to look straight ahead and put your feet together and your arms at your sides. Okay, and now we're going to look for any swaying. So I need you to close your eyes. And I do not see any disturbances in his balance or his gait. Perfect. Okay, you can have a seat. And I want to thank you for allowing me to do your assessment.
No, I just want to get my clothes back on.
And do you have any questions?
No, aside from when can I put my clothes back on?
You can put your clothes back on,
Thank you.
and thank you for your time today.